Good morning. My name is Mark Head. I'm the Vice President of External Affairs for Mount Sinai South Nassau. We're coming to you live on Facebook this morning at 11 a.m. with Dr. Lucille Hughes, who is our Director of Diabetes Education. And Dr. Hughes is going to answer some of our questions about diabetes during the time of COVID-19, during this pandemic, and why it's important to know what you need to do while you're dealing with your diabetes during COVID-19. So we'll get right to it, and thank you for coming to interview with us today. The COVID-19 pandemic has brought a lot of changes for everyone, undoubtedly.
Yes, it has.
And people with diabetes, we've been hearing, have been categorized as at risk. So what specifically can you tell us categorizes them at risk, and what other underlying conditions might they have?
Certainly. So first and foremost, I think it's important to understand that a person with diabetes is not at greater risk of getting a coronavirus, in this case COVID-19 or any other viruses or illnesses. The challenge is when they do get sick, that it becomes more of a challenge and an issue. A couple of reasons why. Number one, when we get sick, our body needs more sugar, glucose, to fight an infection. Glucose is our body's energy source, like gasoline in your car. Our body uses the carbohydrates, which turns to sugar, and that's our body's fuel source. So in times of illnesses, the level of sugar is going to go up, naturally goes up to give our body more energy to fight that illness. That, of course, in a state of diabetes, a person with diabetes, is going to elevate their blood sugar, which can then cause a need for adjustment in their medication, conversations with their physician more proactively, and also to keep in mind, too, when our blood sugar increases, it actually causes a state of inflammation. So hyperglycemia, or high blood sugar, causes an inflammation state in our body, which adds insult to injury when you do get sick and you have another issue. Also with high blood sugar, remember in our body we have white blood cells which fight infection. Those are the cells that want to really fight and keep us healthy. They can't fully do their job when we have high blood sugar. The high blood sugar inhibits their ability to do their job as best as they should. So it causes some issues there. Your second question about underlying conditions is very important to keep in mind. Diabetes is not just diabetes or a state of hyperglycemia. Diabetes is also a cardiac disease, and there's many underlying conditions that a person may have when they have diabetes. Actually, hypertension or high blood pressure, cardiovascular disease, some people have high cholesterol, and maybe some kidney involvement. All of those other underlying conditions can cause challenges during a time of recovery or even treatment with this virus or any other illness.
Great. What should people with diabetes really know about being prepared during this time?
Great question. So first and foremost, like everybody else, we want to be prepared if we get sick. So for a person with diabetes, we're going to add another layer to that. And what we teach in our program, in the diabetes education program, is about sick day management, which comes in very handy with this COVID-19 or any other illness. And we suggest a wellness, or I should say sick day, however you want to look at it, cabinet or box, where people with diabetes would keep things in that cabinet that they may not normally have in their house. For instance, regular Jell-O, some ginger ale, not diet ginger ale, some soups, some Gatorade, making sure that you have a working thermometer, right? Making sure that you have your Tylenol, medications on hand. I have a few things here marked to show you. We have blood glucose meters and strips. In a time of illness, whatever illness it may be, a person with diabetes is going to have to check their blood sugar more often throughout the day. So you want to make sure that you have an ample supply of everything that you need right now that you use to manage your diabetes. You're going to need more of it. So making sure that your meter's working, that you have an ample amount of strips to check your blood sugar, lancing device, the Lancets. If you're taking your insulin by insulin pen or other injectable medications which we use for diabetes, which are very common, you want to make sure you have enough of them, and the pen needles to deliver that medicine. Insulin syringes, some people are still taking their insulin with syringes. We want to make sure you have enough on hand, and of course your insulin and any other medication you're taking for your diabetes, and more importantly, making sure that everything is not expired. You want to make sure that you're looking at this information, this equipment often.
Excellent, excellent. So if a person with diabetes were to be diagnosed with COVID-19, what do they need to do? Is there anything different that people with diabetes need to do versus someone without diabetes?
Well, that's a good question too, because it really is pertaining to their diabetes. So if they were to get diagnosed with COVID-19, we really want that communication with their provider very, very soon. We want to start that communication. They're going to be checking their blood sugar more often. It could be every 2 hours. It could be 4 to 6 hours. That's going to depend on how that illness is reacting in their body, but they want to stay on top of that. There's also ketone testing, primarily for type 1 diabetes, and that's a conversation to have with your physician. Usually blood sugar is over 240 in type 1 diabetes. We want to make sure that you're testing urine for ketones, because what we are seeing with the COVID-19 is an increase in diabetic ketoacidosis, which is a complication that can occur with type 1 diabetes and with some type 2 diabetes. It's rare, but we are seeing that, so we want to make sure that patients are staying really on top of their diabetes and checking more often. Also, great logs. You want to make sure that you have a notebook nearby, so when you talk to your physician, you can give them the most up-to-date information. This virus is also causing vomiting and diarrhea for some individuals. That can cause challenges dealing with blood sugars as well. So your physician's going to want to know what your latest temperature is, the last time you took your medicine. If you are vomiting or having diarrhea, when was the last episode that you might have had? And our main goal is to keep somebody with diabetes out of the hospital. So that communication, staying on top of things, is really, really important during this time.
So you mentioned logs, and the logs are really important. And there are a lot of online options for keeping notes that will cross platforms. That's very helpful when the person, for instance, can enter notes regarding their condition on their home computer, but then they can also pick up those same notes on their phone or their iPad or other tablet. And that's a very useful tool, especially in managing diabetes. I have a person with diabetes in my household, and it's one of those things that's a very useful tool, and I'm glad that you brought that up as far as the need to keep logs and then the need to be able to access those logs when you need them. Very handy to have it on the phone, because when you go to the doctor's office, you are not going to have your desktop or laptop computer with you, so you'll want to have that availability. A question about if someone with diabetes were to be sick with COVID, do they continue to take their daily meds?
Yes, absolutely they should. Again, that may change. For instance, if their blood sugars are now increasing, we might have to adjust the medication, that they might need more. The mistake and the concern we have is with some individuals with diabetes, when they do have vomiting or diarrhea, they assume that they should stop their medicine. And this is not the time to stop their medicine. This is the time to have that conversation with the provider to say, this is what's happening right now. These are my blood sugars. What do I need to do with my medication? Many times we need to increase them, but it needs to be that conversation with the provider.
So we want to hear from you. If you have questions, we'll start taking those questions, and then we'll answer some of the questions at the end. But just to let you know that we have the forum open for questions. I recently heard that the drug hydroxychloroquine is sometimes used to treat coronavirus. Can interact or be toxic when it's combined with metformin, and that is a common drug for people with diabetes to be taking. So I wanted to ask, how long does a person need to be off metformin in order to be safely treated with hydroxychloroquine, or do we not treat with that at all if the person is on metformin? Discuss that a little bit.
Well, we don't really know a lot about the medication with COVID-19. So we have to start out with to say that as much as there's some talk in media, there's conversations that people are having, and it's even being used right now, as you mentioned. There isn't a lot of data with how it works in COVID-19. We're trying it. We do know that patients are taking this medication that have other illnesses. It is prescribed for other illnesses such as lupus and certain types of rheumatoid arthritis. But the use in COVID-19 is very, very new. So we want to be cautious of what we say about the medication and whether or not it interacts with metformin, which is, again, a very common medication, first line of treatment of choice for patients with diabetes, especially type 2 diabetes. So what I'd like to say about that is, let's look at two patients. The patient that's actually in the hospital, that's sick enough, that is admitted into the hospital. We usually take patients off their metformin. It's not a drug that we like to continue while they're in the hospital, and we would put that person and our patients with diabetes on insulin, which is very safe and effective, whether you're in the hospital or in the community, a very safe and effective drug. So there wouldn't be that concern there. But the patients in the community that might be hearing about this medication and wondering if they should take it, if in fact they get COVID-19 and they're taking metformin, you need to have that conversation with your physician, since we do not know enough about it. And we might have patients with diabetes that are taking it that don't have COVID-19, but this virus adds another layer of uncertainty. We don't know what it's doing in the body, so we really don't want to go ahead and say everyone should be taking that. Have that conversation with your physician and make sure it's safe for you.
Right. Now, some may say, okay, so I'm in the hospital and now I'm off metformin and they're going to have me take insulin. Would the insulin be administered as tablet form or in injection? How would that be done?
Sure. So insulin is only right now in an injection or nasal. We can inhale it, but that's not a form that we use in the hospital. So in the hospital, it would be either by injection or by a drip, like an IV. So patients are you know what an IV is like, so we just put it in an IV if you need an insulin drip, or we would do injections. And just because you need insulin while you're in the hospital, that does not mean that you're going to need insulin when you go home.
That's a great
Many
point.
times when that illness, whether it's COVID-19 or any other illness, once you've recovered, very often a person will go back on the medications that they were on prior to that admission. But we take every person as an individual and we make sure that they're safe when they go home.
Perfect. That's exactly what the answer I was looking for. Mount Sinai South Nassau operates a diabetes education program that you run and other outpatient services for people with diabetes. Are these services still open, and what can patients do at home to best manage their diabetes?
So, good question again. The diabetes education program is still open, but think of it as a school. And right now, schools are delivering their education virtually. So we're doing the same. We want our patients to call the diabetes education program, which is 516-497-7500. Our administrative assistant, Molly, is listening to our calls all day long, 8:30 to 4:30, and she then calls the patient back. She schedules a virtual appointment with one of the diabetes care and education specialists, and we're able to continue providing our patients with the best education they can receive for diabetes.
Excellent.
What they can be doing at home is many of the things that we've been talking about. Like everybody else, we want our patients with diabetes to practice social distancing, wearing masks when they're outside, washing their hands often, drinking, keeping again, hydration is a big issue with this illness, so making sure that they're well hydrated, washing things like disinfecting your cell phones, things that you take for granted. Everyone, whether you have diabetes or not, should be practicing those great safety measures. And then if you have diabetes, to really stay on top of your blood sugars and your care, and having that conversation with your providers and your diabetes care and education specialists.
Perfect. Thank you so much, Dr. Hughes, for joining us today.
My pleasure.
And we're looking forward to answering a couple of questions here One of the questions that our audience has is, are there any vitamins that are beneficial for people with diabetes?
So that again is a discussion to have with the provider, but believe it or not, many of the over-the-counter things that we can buy are not FDA approved, so vitamins fall into that category. I'm not saying vitamins are not good, but even vitamins that you think are fine for everyone to take may interact with a medication that you're taking or a condition that you might have. So we do promote certain vitamins, especially with COVID-19. There are some that have proven to be a little bit beneficial, but that has to be done on an individual basis. Talk to your provider to say, hey, if I were to take, let's say, vitamin C, does it interact with any of the medications that I'm taking, and so on and so forth.
Right. Good question. Thank you for audience for providing that question. So I have a child with type 1 diabetes, this questioner asks. Acetaminophen elevates blood sugar levels. What should I do?
Again, luckily we're not seeing that many patients that are children with contracting the COVID-19, but in any case with diabetes and taking something, again, here's something benign like a Tylenol, to have that conversation with that child's pediatric endocrinologist to find out how do we manage that. It also, some of the continuous glucose monitors and maybe issues and questions regarding certain therapies and how it reacts to blood sugar. So again, great question. Talk to the provider. Make sure that you understand how each of these things will affect your child and their blood sugar.
Perfect.
And then it'll be very manageable.
In each of these situations, you notice that Lucille has brought up to talk to your provider. That's probably one of the best pieces of advice that we can give, is that every situation is individual, and you should be having that conversation with your provider about the concerns that you would have. Another question, for the Diabetes Center, please repeat the phone number. Was that?
That's an easy one. 516-497-7500.
516-497-7500. Also, do you have evening hours for people who work?
Yes, we do. We have evening hours. So let's talk about, just very briefly, the center or the program in times when we don't have COVID-19. So what does it normally look like? We do have hours Monday through Friday. We also have evening hours. We provide diabetes education. Again, all of our educators are diabetes care and education specialists. We offer our education face-to-face, one-on-one. We offer group programs. We do offer a free type 1 support group and a free type 2 support group, which meets every month throughout the year. We also have a diabetes prevention program, and I'm so looking forward to all of these particular programs getting up and running. We have a full service program. I'm very blessed here because Mount Sinai South Nassau from day one has been very, very proactive and supportive of our community members with diabetes. So we have our diabetes care and education specialists are well-versed in insulin pump therapy, continuous glucose monitoring. We do it all here, so we're really, really proud to be a part of this system. And I also want to mention too, because many of the patients with diabetes are very concerned and worried about if they were admitted. And of course, we want to prevent that. We want to keep our patients healthy and home. But please know that we have diabetes care and education specialists actually in the hospital. So Maura Carragher, who is a registered nurse and a certified diabetes educator, we now call them diabetes care and education specialists, has years of critical care experience as well as being a diabetes specialist. She's running the show in the hospital in the inpatient side, and she's assisted by Jamie Ravitt, who is a registered dietitian, also diabetes care and education specialist. So again, really blessed to know that you have specialists in diabetes in the hospital as well. So we're very lucky here at Mount Sinai South Nassau.
One of the great programs that is generally offered during the year is a program that Lucille has called Sit Down and Get Moving, and it's an exercise program that you can do from your home chair, and it's a great, very innovative program, and we look forward to getting back to that once this has passed. A couple more quick questions. One is, please review the recommendation for the sick box that you described again for items to have on hand.
Oh, certainly, sure. So again, these are things that you might not think about, because if you have diabetes, we often have sugar-free sodas. But in a sick day box, remember, if you have nausea or vomiting, or you have, you don't really feel like eating, you don't feel well, you have to keep those carbohydrates coming into your body. So we want to make sure that we have things in that sick day box to keep our nutrition up. It's not the time to go shopping. Mm-hmm. So you want to have regular ginger ale or Coke, let's say, or Pepsi, whatever. You want to have Gatorade, sugar-free, cough syrup, some soups, canned soups, because they have a good long shelf life. Regular Jell-O, not the sugar-free Jell-O, which you would normally have in your house. Making sure you have your Tylenol, and of course all your supplies, extra supplies, and I have to reinforce making sure that you check the expiration date on everything you have in that box. Working thermometer, we found that out with many patients right now with COVID-19 and this particular pandemic we're having. When we say, what is your temperature? Oh, I just pulled that thermometer out, I haven't looked at it in months, and the battery is out, and you don't want to be going out trying to get batteries.
One inquirer writes, can stress raise blood sugar numbers?
Oh, stress can raise your blood sugar faster than almost any food you put in your mouth. When we are stressed, our body releases adrenaline, and I'm sure you've all heard of adrenaline or epinephrine. And what that does, you heard of the fight or flight syndrome, right? In order to fight or to run away, your body needs that extra boost of energy. And guess what that energy is? Blood sugar. Sure. So when we are stressed, our body is trying to release extra energy to help us to deal with that stress. Unfortunately, when you have diabetes, we see that in your numbers. That blood sugar is going to go up, and then we need to address that.
So last question, should people maintain their exercise regimens during this period of quarantine, lockdown?
That goes for everybody. So whether you have diabetes or not, we actually recommend, and whether it's sit down and get moving, doing those exercises in your chair. I mean, a lot of people believe you have to, going out and go to a gym or whatever. You can do a full exercise program sitting in your chair without ever standing up. So we highly recommend for every individual, whether you have diabetes or not, to keep your body moving. You can use water bottles as weight-resistant weights. You can walk around your house. You can go up and down the stairs. You can do anything you think about. Just keep moving. This is not the time to put on weight. And of course, excess weight makes it more challenging to manage diabetes.
Right.
And also it adds inflammation and challenging times to treat.
And with so many people sitting, watching television, doing something to try and occupy their brains, they're not always doing things to occupy their bodies.
Right.
To be able to keep the weight off. So that's an excellent suggestion. Excellent suggestion. Thank you so much, Dr. Hughes, for joining us today. Thank you, audience. We appreciate your attention, and we're looking forward to our next Facebook Live. Stay tuned, and we'll see you soon. This is Mark Head, Vice President for External Affairs.
Stay well.